Mr. Patel is a 38-year-old Asian Indian American male patient who comes to the office complaining of weight gain of 15 pounds over the last 3 months, along with all around feeling tired and uncomfortable. Patient also states 1 month of urinary frequency and excessive thirst. He does not measure how much he is drinking but states he has been very thirsty. Mr. Patel denies burning or pain with urination. Urination is copious amount, about 6 or 7 times per day. Patient admits of eating poorly, including a lot of fast food and takeouts, consuming high carbohydrates and fried foods. Mr. Patel also admits to eating more than he should. Mr. Patel admits of being stressed out and not having a lot of time, and eating comfort foods seems to soothe his anxiety. He is a full-time grad student and works as a teacher over 25 hours a week. He is also writing screenplays and grading, which takes up even more of his time. Patient drinks up to 4 cups of coffee a day and he is only sleeping 4 to 6 hours per night. Patient denies suicidal ideation and likes his life. Past medical history: he was diagnosed with type 2 diabetes 5 years ago and hypertension 1 year ago. Denies surgery or hospitalizations. Medicine history-wise, he has the home medications including hydrochlorothiazide 50 milligrams, which he takes per oral daily for hypertension, escitalopram 20 milligram per oral taken daily for anxiety, and metformin 500 milligram per oral is taken twice daily with meals for type 2 diabetes. He also denied any adverse reaction of any of his medications. He takes no over-the-counter medicines, admits to taking medication as prescribed and without missing doses. Family history-wise, his father had hypertension, mother had type 2 diabetes and hyperlipidemia. His maternal grandparents' medical history was unknown, who died in India, as well as paternal grandparents. Social history-wise, patient is very busy with school and work. Patient denies any alcohol, illicit drug use, or tobacco use. He admits to not having time to exercise or play tennis as he used to. His assessment-wise, generally he was tired, appearing well-dressed, somewhat depressed in presentation, admits to feeling off and uncomfortable. Hint-wise denies allergy or sinus symptoms. Respiration-wise denies shortness of breath. Lungs were cleared. Cardiac-wise denies any chest pain or palpitation. He takes hydrochlorothiazide 50 milligram daily for hypertension, as mentioned earlier. GI system-wise, no change in bowel habits, positive for polyphagia and polydipsia, and 15-pound weight gain in the last 3 months. Genitourinary system-wise, polyuria without burning, odor, or infectious symptoms, copious amounts. Endocrine system-wise, he is feeling off and uncomfortable. Saw eye doctor 1 year ago without any issues noted. He takes metformin 500 milligram twice daily for type 2 diabetes. Vascular system wise, he denies numbness, tingling, soreness, or there is no presence of any wounds. Musculoskeletal system wise, feeling tired and uncomfortable but not necessarily weak. Neurological system wise, he denies any vision changes, dizziness, headache, or weakness. Psychological history wise, feeling overwhelmed with school, work, and screenplays. Sleeping 4 to 6 hours or less per night but is sleeping well. Takes escitalopram 20 milligram daily for anxiety and denies suicidal ideation. Objective data wise, the patient provided blood pressures from home while on hydrochlorothiazide 50 mg daily. 4 weeks ago, the blood pressure was 142 over 96 millimeter of mercury, and 2 weeks ago was 144 over 92 millimeter of mercury. The last fasting blood glucose on record was 1 week ago at 210 gram per deciliter and an hemoglobin A1C of 9.3%. His random glucose 4 weeks ago was 218 milligram per deciliter and 2 weeks ago was 220. 6 months ago, Mr. Patel's fasting blood glucose was 142 milligram per deciliter with an hemoglobin A1C of 7.5%. Patient confirmed he has been taking metformin 500 milligram twice daily and not missing doses. Patient appears depressed, would benefit from alternative therapies in addition to his escitalopram for stress and anxiety relief, such as walking and increased activity, which would benefit his blood pressure and glucose levels as well. Also, assessment-wise, patient's blood pressure is not well controlled on current regimen of hydrochlorothiazide 50 mg daily. Patient's blood sugars are not well controlled and are worsening based on the latest lab results while taking current regimen of metformin 500 mg twice daily. Patient is exhibiting signs symptoms of uncontrolled blood sugars, also which is related to his poor diet, stress, and sedentary lifestyle. Plan, I would encourage walks, exercise, and alternative measures to aid in relieving his stress and anxiety, which will further improve blood pressure, blood glucose as well. Handout and websites are provided. If not improved after 4 weeks, consider therapy and consult. Encourage improved diet with reduced carbohydrate and fried food consumption. If time is difficult to prepare healthier foods, encourage healthier choices when ordering it, such as salads or wraps versus pizza or fries. I would add glipizide 2.5 mg twice daily to metformin 500 mg regimen for improved blood glucose control. Combination of pills are more cost effective for the patient. Record blood sugars before each meal and at bedtime for 2 weeks to monitor new medication effectiveness. Call with record in 2 weeks and will adjust it as needed. Signs symptoms of low blood sugars were discussed with the patient. I would also add lisinopril 10 mg daily to a reduced hydrochlorothiazide regimen 50 mg to 12.5 mg for improved blood pressure control. Lisinopril will also lower his cardiovascular risks related to hypertension and type 2 diabetes. A combination pill is more cost effective for the patient. Patient is to monitor home blood pressure each morning and evening and record it. Call the nurse practitioner in 2 weeks with record, and nurse practitioner will adjust as needed. Thank you.